Hey gang, Maverick here with some possibly life-saving information for you. I came across this article by Dr. Stephen Sinatra. He's a highly respected cardiologist, and his integrative approach to treating cardiovascular disease has revitalized patients with even the most advanced forms of illness. This article is about a little enzyme called nattokinase. It's an enzyme derived from natto, which is a traditional Japanese soybean dish. Nattokinase helps address one of the most overlooked problems in development of coronary artery disease, hyperviscosity, which is basically thick and sticky blood that moves slowly through the circulatory system. And the hyperviscosity feeds the inflammatory process that damages arteries, and sluggish blood flow also makes it difficult to prevent blood clots from forming. Nattokinase reinforces the actions of plasmin, which is your body's own enzyme that breaks down the body's clotting agent called fibrin, thereby preventing abnormal thickening of the blood in order to improve circulation. Because of its clot busting and blood thinning properties, nattokinase is used to treat coronary artery disease and prevent heart attack and stroke. Dr. Sinatra also recommends it to any of his patients with high blood pressure levels. He says he's seen it result in such significant improvements in blood pressure levels that patients are usually able to cut down and sometimes even cut out their blood pressure medication. Typical results are reductions of 10 to 20 systolic points and 5 to 10 diastolic points. Of course, you should not combine nattokinase with Coumadin, a blood thinning drug, because it may result in you having too little fibrin to form any clots at all, putting you at risk for bleeding events. So here's the thing. My wife Karen, a few years ago, had a blood clot in her leg. And of course, typical treatment, she went to the doctor. He put her on Coumadin, warfarin, which is really a dangerous drug because it can cause you to bleed to death. It hinders blood clotting. And, they monitor this and keep the levels of your, what they call PTI&R, and always adjusting your dose and all that stuff. But when I found out about nattokinase, I started taking it myself just to prevent heart attack and stroke, because it keeps your blood from clotting when it should not clot, but yet it helps it to clot when it should. And that's the thing. You want it to clot if you cut yourself, or if you have an internal injury, or if you have surgery, or if you even have surgery. But you don't want your blood clotting when it shouldn't clot and getting clogged up in your arteries. So nattokinase prevents that from happening. It basically normalizes your blood clotting process. Since Karen has been taking nattokinase, she has not, of course, been taking Coumadin or warfarin. She's not had a blood clot. And I remind you, for those of you who may not know, she's basically bedridden, so she's at high risk for blood clots. But nattokinase has been very likely a lifesaver. But aside from that, it's a natural substance. Coumadin and warfarin basically being rat poison and, a chemical thing. I never like putting chemicals into my body or anybody's body whom I care about or love, but nattokinase is a natural substance. It won't do any harm. Like a lot of things, the only way it might do harm, so to speak, is because it's so effective that if you take it with a drug that's doing the same thing, then it sort of amplifies the effect. So it's like Dr. Sinatra says, if you're taking nattokinase, you don't want to be taking Coumadin, or vice versa. And chances are, if you talk to your doctor, he's not going to know anything about nattokinase. But be that as it may, I would suggest you research this. Google Dr. Stephen Sinatra, cardiologist. This article was probably from his website. I got it back in 2014. And read and study about it. There's been a lot of research on it. It's just that, a lot of cardiologists don't know anything about it. It's typical of doctors. They don't know a lot of times the latest things, particularly if it's a natural thing, because all the information they get is usually from their drug reps that come through their office about the latest drug. So, they're not kept up on the natural things. But this particular article, I'll show you right here, it has a whole series of questions on the back page as well. Q&A that people asked about nattokinase, and it should help answer your question. So if you are at risk for blood clots or even heart disease, you've been prescribed aspirin every day, which is, you need to research that too. If you've been prescribed any kind of blood thinner, it doesn't have to be Coumadin or warfarin, it can be some of those other brand names, is it Plavix, and I don't know, you need to consider the option of nattokinase, because it could save your life. So I hope you'll follow up on this if this applies to you, and good health, God bless, and we'll talk to you tomorrow.